I'm Len May, and I'm the CEO, co-founder of Endocanna Health. We're an endocannabinoid genomics company, and I have the distinct pleasure of having Dr. Chris Spooner join me, who's a naturopathic specialist, and we're going to discuss this topic and many others. Tune in. Thanks.
In terms of the immune system and looking at your DNA and some of the things you just mentioned, is it different if you already have the COVID-19 or you're producing symptoms? Like there's one path where you look at preventative measures. What are you susceptible to based on your potential genotypes? But however, if you've already have the virus or been diagnosed or are symptomatic of that, are there different pathways, or is it a different path and different genotypes do you look at in that, so somebody has a greater immune resistance, etc. So I just want to kind of separate the two, so maybe you can talk about both of those areas.
Yeah, so let's take the one of kind of like the epigenetic stress that you mentioned here a little bit. Some of the factors that we're seeing with this illness, with this viral infection, is that people that are, diabetic and are, cardiovascular disease, and it looks like, for those of you that have been following this at all or anything, you may be noticing that there's a conversation about ibuprofen, and should people be using ibuprofen, and does that make the disease worse? From what we understand around the genetics of that is that there is a receptor in the lining of your blood vessels, kind of like a little locking key, that is the entry point for the virus, and it's called ACE. Well, it turns out that same receptor is also involved in things like blood pressure medications. And when your blood glucose is out of control, like in diabetes, it makes more of this little lock, if you will. Other things that come in as ibuprofen also gets more of this receptor out there. So there's some cases where there might be some genetics that are involved in that particular receptor that speeds up your susceptibility to the virus, allows it to get in and be more problematic.